Okay, we are live. Hi, Dr. Bree. How are you today?
I am great. I'm so excited to chat about my favorite topic.
Yes, and what are we talking about today?
We are talking about our pelvic floors and how to, naturally care for your pelvic floor, naturally restore your pelvic floor,
Mhm.
what the pelvic floor even is and why you should care about it, all of that.
Yeah, I have to say, I'm really excited. I think obviously your pelvic floor is something all women should know about and have the information they need to keep it healthy. But I've noticed over the last couple of years, pelvic floor health has kind of taken a rise. I've seen a lot of different doctors or physical therapists like yourself really bringing to light how this is a huge part of your women's health.
Yeah. Yeah, exactly. I think, thank goodness it's on the rise because this is such a vital part of our body and so many people have problems with it. So I am
Hmm.
thrilled that people are finally talking about it.
Yes, I am too. And for anyone who's just joining us, while we wait for some more people to come on, if you've ever experienced pelvic floor pain or dysfunction, or maybe you have questions that you want to ask Dr. Bree, please drop them in the comments and we'll be sure to get to them at the end because we have an expert here on our hands, and I'm really excited to have you on here. Um, Dr. Bree is actually joining us from Germany, right? Is that where you're at?
Yeah, so thanks for accommodating my time zone. I appreciate it.
No, you are more than fine. It's nice to have the daylight. Usually I do this in the evening, so I have
Yeah.
the windows open and it's all nice.
Yeah.
So I wanted to introduce you to everyone because they don't know you as well as I do. So Dr. Bree has over 200,000 subscribers on YouTube. She has her articles featured on Mind Body Green and courses on Daily Om. She is the host of a 5-star reviewed podcast, Dr. Bree Lady Bits, and she is a doctor of physical therapy and has been since 2006 from the Pacific University of Forest Grove, Oregon. She works with women and men to help them live vibrant lives, even with pelvic health challenges. Welcome, Dr. Bree.
Thank you. Yes, very glad to be here.
I'm excited to have you. So let's get started. So tell me a little bit, what is your pelvic floor?
Yeah, let's definitely start there. And I have models. I'll probably share them a few times, but let's go ahead and start with just a visual aid here. So this is your pelvis, okay? And when you put your hands on your hips, you're actually putting your hands on your pelvis, these bones here, the pelvic bones, the ilia. And the pelvic floor muscles are these muscles that we see down
Mhm.
below. So
Okay.
yeah, there's an outer layer and an inner layer, and my model is really cool. It comes apart so we can see
Mhm.
both layers of the pelvic floor. And these are the muscles that you can see they support, they sit at the base of the pelvis. There we go.
Mhm. There we
They sit
go.
at the base of the pelvis and they just support everything kind of like a hammock.
Okay.
The bottom of the bowl, and they support the organs. They act to help close off the sphincters that allow your pee to come out and your bowel movements to come out. They
Mhm.
close around the vagina, so they close things off and they
Mhm.
help support things from below. And they're also a really important part of the team of the entire core. So when you think of your core, it's more than just your abdominal muscles, like your six pack muscles. It's a lot of muscles, and your pelvic
Mhm.
floor is the base of that. So those are just some of the roles. There's actually even more roles than that, but those are the important roles for sure. They kind of
Mhm.
support you and they let things out and they keep things in.
Okay.
So yeah.
And is this something that both men and women have?
Yeah, yeah. Both
Okay.
men and women have a pelvic floor. The female pelvic floor looks a little different because
Mhm.
we have an extra hole that goes through. We have, the
Mhm.
vagina, the muscles surround the vaginal canal. And
Mhm.
then the men have a slightly different shape of pelvic floor because their pelvis is actually a little narrower than the female pelvis. And
Okay.
so there are some differences, but for the most part, they're very similar.
Okay. And what is pelvic floor dysfunction or pelvic pain? What are some of the things that we see people experiencing issues with?
Yeah. So should we just keep it to females or should we
Yeah,
talk about, yeah, okay.
let's keep it to females for now, and if we have some questions, we can branch out.
Yeah, sure. And definitely both, anybody, any person on the planet can have some of the things I'm talking about, but some things are a little more specific to women, especially women who have given birth. But some of the dysfunctions that we can see is bladder leakage. So urinary incontinence is a really big deal. It impacts a lot of people. There are different types of bladder incontinence, but we'll just stick to bladder incontinence, leakage. And even just a little bit is considered an issue. It's something that you should not just take as, oh, this is just a normal part of aging, or I had a baby, this is just what happens. It is common, but it's not normal. Like, it's not something that has to be there. And so I just want to really, from the get-go, tell people that everything I'm going to talk about, you don't just have to live with it. Like, you can actually fix it. And usually by pretty simple, natural techniques. So bladder leakage, also prolapse, is very common. And it's something I had never even heard of before I really started studying pelvic floor physical therapy and really going deep into this work. And so it's becoming a lot more known now, but it's when your pelvic organs, any of your pelvic organs, so your uterus, your bladder, your rectum, they shift, they change, they descend, they hang a little low essentially, and they bulge into the vaginal wall. For example, your uterus might actually come down, or your bladder might bulge into the front vaginal wall. So it kind of bulges into your vagina, bulges into the wall. Or your rectum can bulge into the back vaginal wall. So it can feel heavy. It can feel like you have a golf ball in your vagina. So these feelings are
not comfortable.
No, not comfortable at all. It can also cause back pain and just a lot of obsession, really. I mean, you kind of can't stop thinking about it when you feel like you have something stuck in there. It's like all that can be on your mind sometimes. So really stressful. And then another big issue that we see is pelvic pain and also excessive tension. And that can be associated with prolapse and bladder leakage, but it can also be associated with no prolapse, no bladder leakage, but simply pain. And a lot of times these people have pain having intimacy. And so that can be one issue, that it just is impossible for them to have an intimate relationship with their partner because they're just so tight. So yeah.
There's a lot of different issues or problems, health concerns that can come about. And one thing that you mentioned when you and I were talking a few weeks ago was that back pain, people can experience back pain and not realize that it actually could be caused by their pelvic floor.
You know, I am so glad that you brought that up. I actually, just before we got on, I was like, I want to remind myself of that exact statistic. So I'm going to go ahead and read to you, because I find it really interesting. One study showed that 78% of women with lower back pain have pelvic floor dysfunction, specifically urinary incontinence. So 78%. And then more recently, a group of Canadian researchers found that 95.3% of study participants were found to have some form of pelvic floor dysfunction. And that's about people with back pain. And more specifically, 71% of these people had pelvic floor muscle tenderness, and 66% had pelvic floor weakness, and 41% were found to have prolapse. So these are all studying people with back pain, and massive amounts of people who might be going into their provider thinking they just have back pain actually have associated pelvic floor dysfunction, and things that could be, again, they can be treated, like they're treatable. So it's exciting.
And it is exciting. And what's nice is that these are things you can do at home, or, meeting with a physical therapist like yourself. But these are, you don't have to rely on just ibuprofen or Tylenol or, painkillers because of this pain. There are actual real life tools for you to use. And we're going to go over some of those today during this webinar, which I'm really excited about. So who is at risk for pelvic floor dysfunction, these problems that you mentioned?
I hate to say it, but I mean, everybody is at risk for sure. There's lots of risk factors. I mean, definitely a big one is childbirth and carrying a baby and giving birth to a baby. A lot of people who do have deliver babies will have birth injuries, birth trauma, and just the weight of carrying a baby for 9 months and then giving birth is a big deal, and it can impact the pelvic floor for sure. So that's a big risk factor. But even people who've never given birth or never even been pregnant can definitely have pelvic floor issues. If you repetitively lift very heavy things in a way that's not with good body mechanics,
Mhm.
that can be a problem. If you do a lot of high impact things with poor breathing strategies, or maybe you haven't really worked your core muscles as a team together, that can be a problem. So those are some big risk factors. Another big risk factor that I find fascinating for pain and tension is actually stress. And I think that there's nobody among us who doesn't deal with stress in our lives. And it's a stressful time, especially right now in the world. And so anxiety and stress can play a big role in the tension in the muscles of your body. The thoughts we think actually can directly impact the tension in our tissues. So we've all felt knots in our shoulders when we have stress, but that can happen in our pelvic floor too. And so, yeah, there's a really big risk factor that people don't often consider. So if you have that back pain, or if you have pelvic issues, especially if you feel like you constantly feel clenchy through your butt cheeks, and you might not even really have thought about your pelvic floor, but that area feels constantly sort of clenchy and tight and like heavy and yucky, it could definitely be related to stress and tension throughout your entire body, but specifically landing in your pelvic floor.
Interesting. And with stress and tension, are there ways besides, I guess we're going to get into this, I'm jumping ahead of myself, but you were talking about, strengthening your pelvic floor versus just relaxing your pelvic floor.
Yeah, well, I mean, the interesting thing about all of these issues is I think a lot of people, when they first come in for pelvic, or maybe they see it, they finally realize even that, oh, this is an issue that maybe I could do something about. And they either talk to a doctor or talk to a physical therapist, or they just start researching on their own. They might think, oh, well, I've got to go do Kegel exercises. Like Kegels are the best thing to do, the pelvic floor strengtheners, where you're contracting those muscles and letting them go. Well, that I always say that is a step that can be helpful for some, but not all people. But the most important step for almost everybody is actually to first just identify where the muscles even are in your body, and also to learn how to let them go. Because pretty much anyone can at least benefit from that being a starting point. Because that way, if you are too tense and too tight in those muscles, which is very common, because tight, tense muscles are not strong muscles. They don't function well. They're just tight and tense, and they're tired, and they're exhausted, and they're painful, and they're tender. And so even if they're not tight and tense, it's not going to hurt anything by stretching and just kind of doing some relaxation work and just identifying the area. And if you are tight and tense, it's going to help you, because then they'll be able to release so that you can successfully strengthen without amping things up even more by doing a bunch of Kegels.
Yeah, that answered my next question. Was that basically the only thing I knew about the pelvic floor before I started talking with you was Kegel exercises. And I'm pretty sure, I think that's maybe what everyone else knows, is that like, okay, you just squeeze kind of, and like that's what you do, and you're supposed to practice those as a girl, like after you have children, or if you do have like these bladder leakage issues like you were mentioning, like that's just, you Google pelvic floor and it's like 5 Kegel exercises for you to try out, which sounds like there's a place for that. But what are some of the first steps? So when you're talking about relaxation, what do you take a new client or someone who's experiencing pelvic pain or dysfunction to start with?
Well, I think one of the first places is, again, like, where the heck even is the pelvic floor? And I know that I showed it here. So that's important, just to get a visual representation of kind of what we're even talking about. But I have another model that is also helpful to kind of show these muscles here. And this is, if you were looking down into the pelvis, the colored area is some of the pelvic floor muscles, and also some of the hip rotator muscles as well. And then from the outside here. So this, if you were doing an exam, like if you were getting an exam by a gynecologist, this would actually be the anus, and this would be the vagina. So let's just show, if you were putting your finger into the vagina, this is where all the pelvic floor muscles are located. So it's kind of helpful to see sort of what we're even working with here. And this area here is something that anybody can access really comfortably and easy on your own. You don't have to insert your finger anywhere. It's the perineum, so the area between the vagina and the anus, outside. You don't have to insert anything. And it's really helpful to touch, even with your pants or underwear on, whatever. You can just gently sort of like touch that area, even sort of like hover over your chair and just feel that area and laugh, like go like a fake laugh, just go ha ha ha. And you'll feel that area kind of like bulging down a little bit. I mean, we don't want to bulge, but you'll feel kind of some movement there. And you can also cough, a little cough, and see if you feel a little lift. Hopefully, we feel a little lift. You can also use that area to see if you can feel what a Kegel even feels like. And that would be a squeeze and lift of the pelvic floor muscles, and then a full release. So those outer muscles kind of squeeze, and the deep inner muscles that I showed earlier, they really lift. So you should feel a squeeze and a lift, like you're stopping the flow of urine or stopping passing gas. And then afterwards, the most important part is that you also let it go.
So if it's just tight and tense, then you're not going to have the full range of motion and things like that.
Right. And if it's tight and tense, then you are probably going to be like, I don't feel anything. And it'll be really hard to let it go. Maybe you might not even feel a squeeze, and that might be because you were already squeezed, right? And so you might not feel a squeeze. You might feel a squeeze, but you might have kind of like, it feels like almost weird to unwind and let it go, almost like sore, or like, I just can't do that. I can't let it go. Or it might let go in kind of a jagged sort of like kind of a way. So those are all signs that maybe you're too tight. And if that's what you find, then you shouldn't be doing Kegel exercises. That's a really important sign that this is not for you right now. You could do them later perhaps, because they can be helpful to improve sexual satisfaction and to improve continence, and they can be helpful exercises. But again, they're not for everyone, and they're also just a part of an overall total core fitness plan. So
and this is something that you talk about because you have Femme Fitness, right?
Femme Fusion Fitness is my company, is my current YouTube handle and Instagram handle and all of that. But my company is actually morphed over the years. I started Femme Fusion Fitness, 10 years ago. And I've actually expanded to beyond just Femme and also beyond just fitness. And so I've actually changed my name recently to Dr. Bree's Vibrant Pelvic Health, because I really feel when you have a pelvic health issue, it can be hard to feel vibrant about yourself. You can feel really dark in some cases. And so I want people to know that they can live a vibrant life and feel vibrant again. And I've got tools to help them. So I say that only because I'm actually in the process of kind of changing everything over to Vibrant Pelvic Health.
Got it. That makes sense.
I have a ton of information though on my YouTube channel that is about this exact stuff.
Which I love. And you're talking about living a vibrant life, and one of the main people at risk for pelvic floor dysfunction is women who've had children, given birth. And I think, I can't speak for every woman, but that is a big life change. And your body changes physically, internally, like mentally, everything is different. You've sacrificed your entire body basically to bring a little human into the world. It can feel hard to be you're back to your normal self, or be back to the person who you were before you had a baby or before you were pregnant. So finding ways to, get your body functioning the way that feels good for you, I think is a huge step in owning who you are.
Right. Yeah. And everything you just said, I mean, you're tired, your body has changed. And then if you have the added kind of insult to injury of having bladder leakage or some kind of pelvic health challenge, that even worse, a lot of healthcare, I hate to say it, but a lot of people in the medical system and healthcare providers don't always take it seriously. And a lot of women can feel really brushed off, or people, I should say, anyone with a pelvic health issue can feel really brushed off. And that makes it even worse. And so just doing some of these simple tools by yourself, like figuring out where the muscles are, just kind of figuring out what's going on. Can I contract? Can I let go? Most importantly, doing some breathing exercises, even just going shh like that is a really simple starter exercise that anybody can do. Even if they've just had a baby, they can say shh like that and feel, as they say shh, they can feel their low tummy, like right above their pubic bone, those deep abdominal muscles pulling in. And your pelvic floor is very, very connected to those deep, deep abs. And so the pelvic floor will lift a little bit as well. So that is so simple. And you can just breathe into your belly and then exhale with a shh and feel that pulling in of your belly and the lifting of your pelvic floor. It's a tiny little thing, but if you do it early on as a new mom, you can really start just connecting back to that part of your body and feeling a little bit more like yourself again.
I love it. And that's something super easy. And like you said, you can do it from the get-go of
Yeah.
having a baby, just at home, little breathing. Plus, breathing exercises are good for stress,
Always
right?
good.
So
Yep.
it hits.
Especially if you lengthen that exhale, which we're,
Mhm.
relaxing our nervous system and also strengthening our body. Yep.
There we go.
Hmm.
So tell me a little bit more about living a pelvic friendly life. This is something that you teach.
Yeah. So almost, I would say as important as exercise for the core and pelvic floor would be how you live your life. So, I
Mhm.
mean, you could do some Kegels during the day or some core exercises, and that's great. But the way you live your entire day, how you lift things, how you hold your posture, how you transition in and out of bed or from the sitting to standing, all of that really adds up and could constrain your pelvic floor. Also, if you have a chronic cough for
Mm.
whatever reason, that can really strain your pelvic floor too. And so, there's ways to address that. We can figure out how to address the cough or support your immune system, but also make sure that you're coughing in a way that is safe for your pelvic floor. A lot of people lose that natural reflexive contraction and activation of the pelvic floor as they're coughing over time, over having babies, over just for whatever reason.
Mhm.
The body doesn't naturally respond that way because our body naturally shifts and activates at the right time. But
Mhm.
sometimes we lose that and we have to
Mhm.
retrain those natural reactions. So again, treating the cough, like going
It's
for the
kind of like the whole sneeze. Like if you've had a baby,
yeah,
women are like, oh, gotta cross my legs if I sneeze, kind of
right.
thing, right?
Right. And so this is a natural, I mean, you don't have to cross your legs. You can
Yeah.
actually just learn to feel that sneeze coming on or feel that coughing fit coming on and be like, okay, I'm going to consciously activate my pelvic floor, lift my pelvic floor muscles, squeeze off the anus, lift the vagina, like lift those muscles and hold
Mhm.
it while I'm coughing or while I'm sneezing. And then, of course, let it go when you're done.
Mhm.
But that's actually quite common for some people to have chronic cough or other issues like that and then have pelvic floor issues. Also, managing your weight, managing your digestion, because if you have chronic constipation and you're constantly straining to go to the bathroom,
Mm.
or if you're pushing to pee, a lot of people are very busy and they feel pressed for time and they feel like they have to rush through everything in
Right.
life. And so they're like, I'm going to push to squeeze to get my pee out fast. And every time you
And that's
strain,
not good. That's not a good thing.
no,
Okay.
every
Good
time
to
you
know.
strain, no. I used to do it too. I would
Mhm.
also like multitask by blowing my nose while I'm peeing on the toilet. And
Mhm.
anytime you're straining and putting downward pressure on your pelvic floor and those pelvic, when you feel that kind of like that,
Mhm.
that is downward pressure and strain on your pelvic floor. So you want to find ways to minimize that and work with that. It's
Okay.
not like can't ever cough or something. You just have to learn how to activate your muscles correctly. Or when you're lifting something, you exhale as you're lifting the item and you engage your core. Little things like that. And don't push to pee because you don't have to do that. Just let it all come out naturally.
Just enjoy a few minutes of a break, hopefully. We don't
Right,
need to
right.
rush through them all. But what's interesting is that I've never even thought of that even potentially being something bad to do. And
Yeah.
maybe everyone watching this is like, I already knew that. Well, I didn't know that. So
I didn't
I
know it
learned it.
either. You're not alone. A lot of
Yeah.
my clients are always kind of blown away by the pushing to pee or I was always surprised by how many people blow their nose on the toilet like I
Yeah.
used to. I thought that was only me. I guess.
Hey, you know what? When you're busy, you're like, okay, what can I do all at once? And
Yeah,
as a new mom, that's how you got started in all of this
yeah.
pelvic floor
Mhm,
health journey. I feel
mhm.
like you're just looking for any time for yourself to fit everything in.
Absolutely.
So, if anything, it is a reminder that our physical health is hurt when we don't take breaks for ourselves and
Yes,
have moments of rest. Because
yes.
even something like your pelvic floor that you can't really see, it's only internal, we don't really know, or we're not taught a lot about it,
Mhm.
has major problems if we don't have these moments of rest, if we don't find these moments of relaxation. And I think that is actually um, a good reminder, especially for mothers who experience these problems, that you do need that time.
Right. And it doesn't have to take a lot of time out of your day to take care of it.
Hmm.
It takes some learning and training yourself and reminding yourself a few times before you remember, oh, wait, I'm not supposed to be pushing to pee right now. But every
Hmm.
time you retrain your brain, it gets easier. It gets in your muscle memory and you say,
Hmm.
oh, okay, now I'm doing it right more often than I'm doing it wrong.
I love it. I love it. And it's always a learning process and building habits, right? It doesn't just
Mhm.
happen overnight, which kind of brings me to my next question, which is how long does it take once you start working on your pelvic floor to
Yeah.
see results? Is this like long term? Like, is this years? Is this a couple of weeks? What are we looking at?
Well, it really depends on the issue that we're dealing with. So,
Mhm.
if we're dealing with pelvic pain and tension, in my experience, that can take longer to really help people unwind and release and relax and feel comfortable again. If we're talking about bladder incontinence, that can actually, for some people, especially with mild issues, they can see results very quickly, like within even a matter of a couple of weeks, to be honest with you, depending on the severity of the condition. Some people just need to kind of click into place about where the muscles are and like how to activate them and basic things.
Mhm.
If we're dealing with prolapse, that usually takes a little bit longer because we need to sometimes really focus on the relax for a while. We need to gently strengthen the whole core. We need to focus on getting that lifestyle really dialed in, so people
Mhm.
are really managing the pressure in
Mhm.
their body correctly and learning how to activate the muscles correctly again. So, that's at least 6 to 10 weeks or so. I actually offer a 5-week program for prolapse relief, but it takes longer than that. It really does. I encourage people to take their time moving through the program. And
Mhm.
the thing is, with all of these bladder, or excuse me, pelvic health conditions, it's not like going to the gym once and then just forgetting about it. It's something you do need to keep up with. You end up integrating it into your life in a way
Mhm.
where whenever you're doing your core exercises, your regular workouts, you know how to activate your pelvic floor correctly. So you don't have to go do a separate pelvic floor workout, but you do know how to integrate it into your life for the rest of your life. And you need to know how to, again, live that lifted lifestyle where you're lifting things correctly and using good posture and all of that for the rest of your life.
Mhm. And then it's
Yeah,
just a part of it, like
it's
the
just a part of
whole
life.
the
Hmm.
idea of, you exhale while you lift and things
Hmm.
like that, like they just become a habit, and then it's not necessarily something you have to think about
Right.
consciously, right?
Yeah.
Becomes a subconscious thing.
Yeah.
All right. So we have a couple more minutes. So I know we want to do some demos on what we can do to help strengthen. And then we have some questions coming in. So I'm excited to
Perfect.
answer them. So people watching, we are going to get to your questions. Don't worry. So
Yeah.
demo. What are
Demo.
we doing?
Perfect.
Yeah. What are
Yeah,
we
let's
doing?
do it. Okay, so the first thing that I wanted to, well, I think if people are watching, maybe they have already tried this or maybe they
Mhm.
haven't, but go ahead and see. Can you do that squeeze and lift of your pelvic floor muscles? If you had somebody doing an examination right now of your pelvic floor, would they feel around their finger, your
Mhm.
doctor, would they feel a squeeze and a lift and then a full release? So I would just encourage you to try that. And
Mhm.
next, I wanted to share how you can do more than just
Mhm.
Kegel exercises to help work those pelvic floor muscles. They're so closely connected to your other hip muscles, your butt muscles, your abs, the entire core container. There's even a
Mhm.
connection with the breathing diaphragm, which I'm not going to go too far down that rabbit hole today, but it's all connected. And
Mhm.
so one great move to strengthen the pelvic floor is actually, and release as well,
Mhm.
is a squat, like a little mini air squat. And I
Okay.
want to show you how you can really feel the pelvic floor is if you feel your sitting bones, your butt bones
Uh-huh.
right there. So the ones at the bottom that sit on.
Mhm.
I'm going to show you like the most amazing thing.
Mhm.
You do an air squat where you don't even have to go back very far, just a little bit, stick your bum back. And you
Mhm.
can put your hands on your butt and feel those sitting bones come into your hands. Like you can feel them poke into your hands.
Mhm.
And that sensation when they're doing that, they're actually in a minute way, they're widening apart a little bit. This is the way the bones in the pelvis move. It's not a big motion, but it's little, but it's there.
Mhm.
And the pelvic floor muscles are between those sitting bones. And so
Okay.
when you sit back, you're naturally releasing the pelvic floor muscles. And then when you stand up, and especially when you really squeeze the butt cheeks too, and especially when you consciously activate the pelvic floor, like do a little Kegel, your sitting bones come together just a little bit, and you can feel the pelvic floor activate and your butt muscles activate. Everything is lifting as you stand up from that squat. So if you do right now, like maybe 5 or 10 squats, where you come down and release the pelvic floor, and then you can exhale and stand up and feel the sitting bones come together and feel that pelvic floor lift. It can even be helpful to sort of, I like to almost even use my hands a little bit, like think of the release and then the exhale lift, the lift of everything, your entire core when you stand
like
up. Kind of,
yeah,
like it feels like whoosh. You can, so you sit back like you're sitting back into a chair and then straighten up. So that's a really simple thing you can do, 5 or 10 of those when you're making coffee in the morning or something like that. And then the other thing I like people to do is hip circles, because it really releases all of the muscles.
Just like circling your hips.
Yeah, I'll show you here. So you just, stand however, feet like hip width apart, soften your knees so they're a little bit bent, and you just circle your pelvis on the floor over the ground beneath you. So if you want to break it down, you can go forward and then to the side and then to the back and then to the side, and then put it all together, trying to keep your shoulders and your head pretty still. And you're really just kind of circling the core muscles are all working, everything. But your pelvic floor is activated as well. And especially as you circle around forward, you can really feel that lift of the pelvic floor and the pulling in of the low abs. And when you circle around back, it's kind of the same. You can feel like the release of the pelvic floor as you circle around back. And then you want to go the other direction and just even yourself out. But this is
Makes me feel like I'm in a dance class.
Right? It's like belly dance, and it feels really good. And I've had a lot of people I've worked with who have back pain or even sciatica, other issues like that feel so much relief from doing hip circles. They're really gentle. Both of these moves are no impact. They're not extreme, but they're gentle ways to just get the tissues moving and circulation going to the pelvic floor. And then you can just shake it out.
There you go.
Yeah.
Who would have thought that those two things can help activate the pelvic floor?
They can help activate it. Absolutely. They can just get things going. And then if you feel like a Kegel program would help you, then you can do some Kegels too. But again, really make sure you're releasing and letting go. And also don't do them while you're peeing on the toilet. And also don't do 100 each day, because you'll see that floating around online, like do 100 Kegels each day. No.
So don't do 100. Like, is it a Kegel something you should be doing every day? Or
well, it really depends on the person. So, I mean, the two exercises I just showed are generally pretty good strengtheners for most people, but some people really need to actually not be doing Kegels at all. If they're too tight, then they just
got to relax.
Stay away. So if you have any questions about where you are, like what would help you, what would not, then I would definitely contact a pelvic floor physical therapist.
There you go. Okay.
Yeah.
All right. Well, I love it. So we have a few questions that I wanted to have us answer. Let me see if I can find the mouse. So I have Paula, and she asked, what about people without a uterus? Things shift. What exercises to do?
So somebody who's had a hysterectomy, somebody without a uterus, or yes. So if you have a pelvic organ shift and you don't have a uterus, that's actually very common to have your bladder move or your rectum move, a shift happen. That can happen often because the uterus was kind of a puzzle piece holding everything in place. Everything is very tightly knit together in there. And when that uterus is gone, a shift can more easily happen. So what I would recommend for anyone with prolapse is really focus on lifestyle. So again, making sure that you are lifting correctly, you're able to activate the pelvic floor and those deep abs, and you exhale, you breathe out when you're lifting something. Or when you're moving from sit to stand, when you're standing up, try not to be like holding your breath or like bearing down. When you stand up, try to exhale as you go from sit to stand. Those are really some basic starter tips for helping to manage that intra-abdominal pressure so you don't feel that downward pressure throughout the day. And then exercise wise, I encourage people to, make sure you're able to identify and release those muscles, and then just begin a gentle core strengthening program. If you want to do Kegels, one of the best starting places to do, especially for prolapse, is when you can lie down and you can actually be on your back with your hips up on some pillows. So if you imagine you're laying down, your knees are bent and your feet are on the floor, and you just stick a couple pillows or a yoga block under your sacrum, the back of your pelvis here, right back here. So not too high up, but right back there. And you lie down, and that helps everything kind of shift back into place. So it uses gravity to kind of pull everything back into place. And then you can do your Kegel exercises or your certain core strengthening moves. I actually have a whole video on my YouTube channel called Hips Up Fitness. And it has various core strengthening moves where your hips are elevated and it kind of pulls everything back into place. It's a fun workout.
Very cool. All right. If you are planning on being a mom or getting pregnant soon, are there any exercises or pelvic floor tips you have to keeping it healthy and strong before going into pregnancy?
Yeah, I mean, definitely the first thing, again, I keep harping on the lifting, but you as a new mom are going to be lifting 1 billion times every day. That's an exact answer, or an exact number, by the way, 1 billion. 1 billion times every day. So it is important to just make sure you have that in your muscle memory about how to lift correctly, because you're going to be doing it all day long. And really opening up your chest and shoulders and strengthening your mid back, because you're also going to be carrying and potentially breastfeeding and doing things that have you forward. And all of this forward stuff is actually hard on your pelvic floor because you have all this downward pressure. And so you want to practice before having a baby, opening up the chest, strengthening that mid back, just knowing how to be aware of your posture too, so that you have a fighting chance when you're caring for a little one. So,
and also, having a full belly, for a while, you need that good posture. But that is actually something we didn't touch on that we talked about a few weeks ago, is that posture actually has a huge effect on your pelvic floor.
Right. So if you, you can even just do it right now, sitting down, if you feel how it feels to sit with a forward head. Well, that shifts it causes your whole body to go from this to this. It's like you lose a couple of inches and everything kind of just crunches down. And you can feel, if you bring your awareness down to your pelvic area, you can feel your bum kind of tuck under if you're sitting, and just sort of this downward squish onto your pelvic organs. And you can feel that pressure build up, versus if you sit tall, lengthen your crown up toward the sky. You don't need to you don't need to be like this, but just lengthening up, you can feel that decrease in pressure on your pelvic organs and your pelvic area.
Much lighter. Like there's like an airy feel to it.
Right.
More space for things to move around versus compress.
More space for things. It's perfectly stated. Yes. Yeah. So for preparing for pregnancy and preparing for babies, I would say those two lifestyle things are really important. And then just gently strengthening your core, knowing that that includes more than just your abs, it's your pelvic floor too. So strengthening, but also remembering to let go, because you're really going to have to let go of those muscles when you're actually giving birth. So definitely focus on that relaxation piece.
There we go. Okay, and then just a couple more questions. Rachel asked, can you do the circling pelvis exercise while on an exercise ball?
Oh, absolutely. That's a great place to do it. You can also just start with forward and back rocks on an exercise ball, like a pelvic tilt, where you kind of tuck your butt under and exhale and feel your abs pull in and your pelvic floor lift. And then inhale and arch your back and feel your butt stick out back. So just rolling the ball forward and back is a great core strengthener and mobilizes your hips and your back. Or you can do the full circles.
Okay, there we go. And then the last question I have for you is, if anyone watching this, recognizes maybe some of the problems that you shared, whether it's bladder leakage or pelvic pain or back pain, certain things, where do you recommend they start? We talked about the exercises, but what other resources for them to really find the root cause of what could be causing it?
Well, I mean, definitely go see a pelvic floor physical therapist because
Okay.
that person can help test and evaluate your muscles and feel your pelvic floor and see if maybe too much tension is actually an issue. And then if that's you, which I think, I mentioned before that stress and
Hmm.
anxiety and emotional things can cause a lot of tension in a lot of people in their pelvic floors. So a lot of people are dealing with that. I mean, go see somebody to see what's going on. But if you're thinking, gosh, I think I've got something going on here, and you have access to a PT, go see a PT. If you don't have access or you need to wait for your appointment for a little while, I'd say actually one of the first steps is to lie down on your back, as I was talking about earlier. Put your pelvis up on a yoga block or a couple of pillows. So you're in that nice kind of hips up position. I call it hips up.
Hmm.
And just if you feel comfortable, like let your knees flop apart, knees out kind of like a butterfly, and just breathe and relax into the pelvic floor. If that feels comfortable to you, you can cover yourself with a blanket, or whatever, maybe even pad up under your knees so that they're supported, and just relax and breathe into the muscles. It is so nourishing for those muscles, whether you have tension or whether you don't have tension. That is going to feel good for pretty much everybody.
I love it.
Yeah.
I want to go home and try that right now. That sounds
Yeah.
relaxing. So
And use some relaxing essential oil too. Like it's
yes.
really helpful to just relax the mind and the body. Because again, one of the first body parts that stores tension is our hips and our pelvic floor. Just as much as we know our neck and shoulders do,
Hmm.
and we get headaches and all that, our pelvic girdle is the exact same. It's like an instant reactor to stress. And so let it go.
And you mentioned, earlier, stress, tension, that harms your intimate relationships too with your partner. And I think, if you've ever experienced long periods of stress, that is something that you see happen for yourself. So getting into that state of mind, being able to let go of that
Mhm.
fear or stress or anxiety that you're experiencing, I think is a huge part. And I
Yeah.
do have a couple, sorry, I said last question, but I do have one more. Rachel's asking, do you have any tips for finding a qualified pelvic floor therapist?
Yeah, I mean, there is a excuse me, there's a physical therapy locator. There are actually a few. The
Mhm.
one that I'm most familiar with is with the if you're in the United States, it's with the American Physical Therapy Association. So if you did a Google search for
Mhm.
APTA, American
Mhm.
Physical Therapy Association, um, pelvic floor physical therapy locator, it will pop up. There will be
Okay.
that, but those are only going to be showing you PTs that are registered with the APTA that have gone through their training program. So
Mhm.
there are other PT locators online. You could just do a search for PT locators, or probably what I recommend is just asking for recommendations in your
Mhm.
local area. So then you have, you talk to people who've been to somebody, because you want to make sure that your PT is a good fit for you, that you feel
Mhm.
really comfortable with them, because it is an up close and personal examination. And so you
Mhm.
want to feel really good about who they are and how they work with you.
I couldn't agree more.
Yeah,
Well, thank you so much, Dr. Bree, for being
of
here today.
course.
I learned so much. I hope everyone who's watching also got a lot of great information. I have some new exercises that I'm going to be adding
Go
to
do your
my
squats and your
little
hip
routines.
circles.
Oh,
Yeah.
yeah. Well, and the hip circles makes me feel like I'm in a dance class, so that's always fun. So I love it. But thank you again so much for coming, and I hope you have a wonderful day. And anyone watching, again, if you have questions and we didn't answer them, drop them in, and either I or Dr. Bree will get to them later. And
Yeah.
thank you again for
Yeah.
coming.
Of course.
All right.
Thanks for having me.
Of
All
course.
right. Bye.
Bye.